Good afternoon, sir.
Good afternoon.
Please tell me about yourself.
Okay, I'm Mr. Leo Pudas, the school principal free of Roa Central School Sped Center. I'm 44 years old.
Thank you. So here's your first question. How do you handle the school campus as a school principal?
Okay, thank you. As a school principal, it's really my duty to see to it that teaching and learning is happening in our school. So it's my routine, daily routine to roam around the campus any time of the day to monitor the attendance of our teachers and to see to it that the teachers are really teaching during classes time. And I also uh, provide technical assistance to our teachers through classroom observations. And I also provide instructional materials to our teachers, materials that can be used during in the teaching and learning process for the teachers to be effective in their teaching. They should be provided with the necessary materials in teaching.
Thank you, sir. Next question. What do you think are the biggest challenges facing education today?
Okay, for me, the biggest challenge that education sector is facing nowadays is the reading skill of our students, of our learners. Because data shows, and even in depth in our division, the schools divisions abroad in Norte, that there are really presence of struggling readers from elementary up to junior and even in senior. There are still identified struggling readers even in senior high school students. That's really the biggest problem that our education system is facing nowadays.
Thank you, sir. Last question. How do you cope the challenges facing in your school?
Okay, since it's the duty of the schools or the education sector, specifically our duty as teachers to let our learners learn, like for example in reading, we find ways, we implemented some initiatives to help these identified learners or struggling readers improve their reading skills. One of those is we implemented remedial reading every afternoon. It's by class because um, there are really identified some readers in every class, especially in the lower grades. That's why I started with teachers. It's an agreement. It's a school policy actually to conduct a remedial reading every day, every afternoon, and in fact, it's part of our school program. Every day, one of the activities uh, in every class is the remedial reading, and we also implement peer tutoring, meaning uh, the independent readers of each class will choose or will help the one struggling reader in the reading session. So meaning he or she is in charge of that particular struggling reader. So it's now uh, his duty or obligation to help us agreed within the class. So that's what we do, and there is really improvement. So it's effective, especially when the teacher is really doing his best or her best, and the pupils also, if the pupils will cooperate. So there is really a chance that this problem is will be, if not 100% solved or um, vanished, but at least the problem will be slowly solved by the interventions that we made.
Thank you,
Thank
sir.
you.
Good afternoon, sir.
Good afternoon too.
Please tell me about yourself.
I am Mr. Antonio Acedo, the District Supervisor of the Wasuan District. 57 years of age.
Thank you, sir. What is your involvement in our community as a supervisor?
Actually, my involvement in the community as a district supervisor is to establish the proper concept, the needs and purpose of community relationship. Number two, to develop an understanding of the principle of good school community relationship.
Thank you, sir. Question, as a supervisor in school,
Actually, my mission as supervisor in school is to provide assistance to the teachers in school in improving their instruction performance in accordance to the professional code established by the Department of Education. Number two, interact with teachers, address school monetary issues concerned, map out long-term school planning, and supervise sufficient fairness program.
thank you, sir. How would you supervise as a district supervisor?
How would I supervise?
Yes, sir.
Number one is ensure quality standards by supervising, inspecting, and evaluating the operation of schools in the entire district of Luas 1. Number two, provides a rich resource of exemplary coaching and mentoring, training of teachers and school administrators.
Thank you, sir, and that's all for today.
Thank you. Welcome.
Good afternoon, sir. Please tell me about yourself.
Afternoon. What's your name again?
Jinilin Sito.
Jude. Afternoon, Jude. I'm Dean Bael. I'm in the first year in Rojas RHU for more than 10 years, I guess. And I'm one of the nurses under the Nurse Tutoring Project, so from HRH.
This is your first question. What is your mission in our community as a nurse?
As a public health nurse, I think my mission here is to serve the underprivileged constituents in this municipality, especially those living in the far-flung areas. When we say underprivileged, those are the IP communities, those are the marginalized sector in this municipality, and then those are the people who do not receive the utmost care that they need, those who do not have the access of quality care, and those who do not receive the proper care in terms of healthcare service delivery. So as a community health nurse, our main function is to be an advocate. So meaning to say, when we say advocate, we have to do health promotion, that is to prevent the health condition from getting worse. Like say for example, they are having these certain types of illnesses, and then they do not go to the health facility because of some certain reasons. So as a healthcare professional doing the profession in the community, we are the ones to link them from their area to the healthcare facility for them to be able to receive the care that they are needing. So that's the mission.
Thank you, sir. Next question. How to take good care of your patients?
Well, for me, in taking good care of our, you mean to say maybe clients, since we are in the community. So maybe we're going to give them the appropriate information, since I was talking about being an advocate. So we're going to provide them the appropriate information that they are needing. Let's say, for example, they don't know a certain information about a certain disease, then you have to provide them. You have to educate them. So that's one way of taking care of the patient. Second one is you are going to render services, health services that they are needing. For example, they are needing medications or medicines for the certain conditions that they are having. So we're going to provide them. And then last but not the least is the health teachings. That is the most important thing that you are going to provide if you are a healthcare service provider in the community. So the health teachings. As we all know, if the people in the community do not know about conditions, they lack the information, they will be doing the wrong things. Then that's the time that the health conditions will get worsened, and they will go to the hospital for seeking treatment. So in the community, as far as we know, we will do health promotion other than disease prevention. So for me, as a healthcare community provider, so that's the best thing that we could do in our clientele in the communities.
Thank you, sir. Last question. Why do you need to take good care of your patients?
I think that is simple. Here in the community, if you're not going to take good care of your clients, I mean not the patients, the clients, the clientele in the community. So when we say the clientele, those are the individuals, those are the families in the community. People will get sick, definitely, and obviously they will get sick. So if people or the constituents in a barangay are getting sick, so what will happen? What do you think that will happen? So we really need to provide appropriate and quality care to these clientele in the community.
Thank you, sir. That's all.